Good day everyone. For today's lesson, we are going to discuss about the diseases under nervous system such as bacterial, viral, and fungal. First one is the overview of nervous system. Infections, we have three main categories. The first one is the bacterial diseases, which are meningococcal meningitis, tetanus, botulism, pneumococcal meningitis, tuberculosis, meningitis. Next one is the viral diseases, which are rabies, viral meningitis, Japanese encephalitis or brain fever, herpes encephalitis, and polio. Last one is the fungal diseases, such are fungal meningitis, brain aspergillosis, and brain mucormycosis. The first one under bacterial diseases is the meningococcal meningitis, which is a severe bacterial infection causing inflammation of the meninges, the reproductive membranes covering the brain and spinal cord. The causative agent is the Neisseria meningitidis or the gram-negative Diplococcus, transmission through respiratory droplets, direct contact with secretions, and the reservoir is the asymptomatic human nasopharynx. Carrier rate is 5% to 25%, and the treatment or the drug of choice is the ceftriaxone or cefotaxime or dexamethasone. Next one is the pneumococcal meningitis, the most common community-acquired bacterial meningitis in adults. The causative agent is the Streptococcus pneumoniae or the gram-positive lancet-shaped Diplococcus. Transmission through respiratory droplets, direct spread from otitis media, sinusitis, or pneumonia. The reservoir is the human nasopharynx, colonizes 20 to 40% of children and adults. Also, the treatment or the drug of choice is the vancomycin plus ceftriaxone or cefotaxime or empiric plus dexamethasone if no contraindication. Next is the tetanus or lockjaw, a serious, often fatal disease caused by a powerful neurotoxin leading to painful morgidity and spasms, lockjaw or neck stiffness that can interfere with breathing. The causative agent is the Clostridium tetani, a spore-forming anaerobic gram-positive bacterium that produces tetanus plasmin neurotoxin. The mode of transmission, not transmitted person to person. Spores enter the body through breaks in the skin or the puncture wounds, burns, minor cuts, umbilical stump. In neonates, the reservoir is the soil, dust, in the intestinal tracts, feces of animals and humans, or spores are ambiguous in the environment. The treatment or the drug of choice for the human tetanus immune globulin or TIG to neutralize unbound toxin and metronidazole for antibiotic of choice to stop toxin production. Next is botulism, a rare but serious life-threatening paralytic illness caused by a neurotoxin that blocks nerve function leading to descending flaccid paralysis or starting with cranial nerves, double vision, dropping eyelids, slurred speech, difficulty swallowing, followed by symmetrical weakness of limbs and respiratory muscles. The causative agent is the Clostridium botulinum, a spore-forming anaerobic gram-positive bacterium that produces botulinum neurotoxin or the BONT, most potent toxin known. Other species like C. baratii, C. botricum, can also produce the toxin. Next is the mode of transmission. In foodborne ingestion of preformed toxin in improperly canned or preserved foods such as home canned vegetables, fermented fish, and honey in infants. The infant botulism, ingestion of spores, example honey or soil, and that germinate in infant's gut and produce toxin. Also, in wound botulism, spores contaminate a wound, especially in injection drug users, and germinate in anaerobic conditions. I Iatrogenic or adult intestinal colonization is very rare. The reservoir are soil, dust, marine sediments, and the intestinal tracts of animals, fish. Spores are widely distributed in the environment. The treatment for the botulism is the antitoxin botulism immune globulin, heptavalent botulism antitoxin or BAT for adults, baby big botulism immune globulin intravenous for human or for infants and administer as early as possible to neutralize inbound toxin. Supportive care, mechanical ventilation for respiratory failure often required for weeks to months. Lastly is the tuberculous meningitis or TB meningitis, a serious progressive inflammation of the meninges and often the brain parenchyma caused by Mycobacterium tuberculosis. It is the most severe form of intrapulmonary tuberculosis, often presenting with subacute onset of headache, low-grade fever, neck stiffness, cranial nerve palsies, especially 6, confusion, and eventually coma if untreated. The causative agent is the Mycobacterium tuberculosis, an acid-fast aerobic or slow-growing bacillus. The mode of transmission is not directly transmitted to the meninges. Primary infection occurs via inhalation of airborne droplets from an active pulmonary TB patient. The bacteria then spread hematogenously to the meninges, forming rich foci that later rupture into the subarachnoid space. The reservoir is humans, only significant reservoir. Active pulmonary TB patients are the source of airborne transmission. The treatment or the drug of choice, intensive phase or 2 months, rifampin plus isoniazid plus pyrazinamide plus ethambutol, often with adjunctive corticosteroids, dexamethasone or prednisolone to reduce inflammation and prevent complications. Next is the viral diseases. The first one is the rabies, a fatal but preventable viral disease that attacks the central nervous system, transmitted primarily via saliva through bites or scratches from infected animals, mainly dogs. Causative agent is the rabies, lyssavirus, ssRNA virus, or Rhabdoviridae. The transmission is through the bite or scratch of infected animal. Also, the saliva. The reservoir is the wild domestic mammals such as dogs, bats, foxes, and raccoons. The treatment is no effective treatment post symptoms. Next one is the viral meningitis, a common, generally mild inflammation of the brain and spinal cord lining caused by viruses like non-polio enteroviruses. The causative agent is the enteroviruses or Coxsackie, Echo, HSV2, varicella zoster, and arboviruses. The transmission is through the fecal oral respiratory droplets, sexual or HSV2, and arthropod bite. The treatment is supportive care or analgesics, hydration if HSV and VZV acyclovir. Next one under the viral disease is the brain fever or the Japanese encephalitis, a serious viral infection of the brain transmitted by Culex mosquitoes. The causative agent is the Japanese encephalitis virus or the GEV and flavivirus. Transmission through mosquito bite of Colex Tritaenorhynchus. The reservoir is pigs or amplifying hosts, wading birds such as egrets or herons. Treatment, supportive care only, no specific antiviral vaccination is key. Next is the herpes encephalitis, a severe life-threatening brain inflammation caused by HSV1. The causative agent is the herpes simplex virus type 1. Transmission through reactivation from trigeminal ganglion or the endogenous reservoir. Humans treatment is IV acyclovir or high dose 10 to 14 days reduces mortality from 70% to 20 30%. Next is the poliomyelitis, a highly infectious vaccine preventable disease causing paralysis. Causative agent is the poliovirus serotypes 1, 2, 3, and the enterovirus. Transmission through fecal oral, the most common, or oropharyngeal droplets. Reservoir is humans. Treatment no specific. The last one is the fungal diseases. The first one is the fungal meningitis or cryptococcal, a rare life-threatening inflammation caused by fungus spreading to CNS. The causative agent is the Cryptococcus neoformans, also Coccidioides histoplasma. Transmission through inhalation of spores, also pigeon droppings or soil, reservoir, birds, pigeons, soil, and bat. The next one is the treatment. In the induction, amphotericin B plus fluoxetine for 2 weeks, consolidation, fluconazole, 8 weeks, maintenance, fluconazole for HIV patients. Next one is the brain aspergillosis, a rare severe fungal infection caused by Aspergillus mold spreading to the brain, mostly affecting immunocompromised patients with high mortality rates up to 100% in some cases. The causative agent is Aspergillus fumigatus or the septate hyaline mold. Transmission through inhalation of Conedia to hemagenous spread from lung. The reservoir are soil, decaying organic matter, and compost. Treatment, voriconazole or drug of choice. Alternatives will be liposomal amphotericin B, asavuconazole, surgical debridement. Last one is the brain mucormycosis, a severe, rapidly progressive, and life-threatening fungal infection caused by Mucorales molds. The causative agent is the Rhizopus, Mucor, Lictemia, or the non-septate posiseptate hyphae. Transmission through inhalation of sporongiospores from environment. The reservoir are soil, decaying fruit and vegetables, and bread mold. Treatment will be liposomal amphotericin B for high dose plus aggressive surgical debridement. Control underlying condition such as diabetes or neutropenia. Posaconazole or isavuconazole as salvage therapy. That's all. Thank you for listening.